The COVID-19 vaccination program has lost momentum due to vaccine hesitancy. This as fewer people are lining up to get their shots at vaccination centers across the country. For more on the rollout program and what government is doing to turn the situation around, I'm joined by Deputy Health Minister Dr. Sibongiseni Dhlomo. Dr. Dhlomo, good morning to you, and thank you so much for your time this morning. Let's begin with the cracks. Where are they as we're seeing less and less people queuing to take the shots?
Good morning, ma'am, and good morning to your viewers. Maybe we shouldn't say it has lost momentum. It's just that there's been sort of a decrease. We were once upon a time last month having 275,000 South Africans who came forward for vaccinations. And just last week, they were at 175,000. We are glad that this morning there's a report that came through that yesterday we were at about 182,000. So it is picking up again. But it came out from the report that we were giving to the NCOP yesterday in Parliament, pointing out some of the identifiable areas where we need to actually strengthen. One, we realize that men are generally not a health-seeking behavior group of people compared to women. Women generally visit clinics and the hospitals for other things, just to say, can you check me if everything is not going well or going well? Now, we are seeing a proportionally less men compared to women coming forward for vaccinations. And therefore, we need to put that and say, can we maybe use some of those programs where we actually use and get traditional leadership to really strengthen men coming in to get this, because we want to take everybody, nobody should be left behind in this health-seeking behavior, because currently now COVID is life-threatening, but we want to move it through vaccinations to be just one of those flus. But the department is also opening up other avenues, getting jabs in malls, getting jabs in the pension pay points and some of the drive-thrus. We would like to continue to expand, because right now we currently do have enough vaccines. It's just that the uptake is actually not going that strong. We also are identifying that from the 60 years and above, there has been a significant improvement. At least 60% of those South Africans have come forward. The 50 years and above, that is, we still need to strengthen. But the 35 years and above, that number is really not improving, and we are concerned about that, because we are now beginning to talk about 18 years and above, meaning every South African eligible for vaccine should now be vaccinated. Now, if we do not get a good take from those, we need to employ as much of the strategies as we can, and the minister is championing us in all these programs that we need to champion going forward.
When you look at misinformation and the concerns that people are raising out there, how much of a concern and a factor is that playing to people simply not showing up?
Yeah, we are not able to measure that, but you are correct. The fake news is one of the things that we need to stamp very strongly. Part of doing that is to get the influencers in the society, the faith-based leaders, the very legends in the societies, the traditional leadership, to come in. Like you see the success story of Limpopo, where you see the MEC going with the strong traditional religious leadership there that has got a membership of over 4 million, getting a jab in the public. So if we could do much more of that, getting those influential leaders coming forward, the celebrities getting into this space and talking about it, we will find many more of us who actually look up to these celebrities, to these leadership in our religious space, and also traditionally going on for this. But then they will also be helping us to counteract the fake news, because the fake news spreads faster and sometimes confuse a lot of South Africans. And yet we are saying, if you get a jab, you will still get probably COVID-19 infection, but it will not be life-threatening. It will not take you to a hospital, into an ICU. In fact, it will reduce chances of you dying. That's the message that we need to put out there. You need to build your own immunity, your own defense against this virus by getting a vaccine.
I wonder then, if you are then looking at getting influential people. I mean, Limpopo has been leading the pack in this one, and I wonder why the national government didn't seem to follow suit. Where will you find the money to engage some of these celebrities? Because I don't think they come for free. And if recent reports are anything to go by, the department simply doesn't have the money for this.
No. We were on Sunday listening to the whole detailed report of Limpopo's success story. And we are not undermining that. As a national department, we think, in fact, there are certain provinces, when we're talking, Western Cape is saying they even have had a one-on-one with the Limpopo province. So provinces are taking this up. Look, we can't say we will not have money to spread the communication message and ramp that up on issues of COVID-19 infections. You see, we sit at the stage where we are not able to open up tourism broadly, opening up sporting activities and also businesses because we are fighting the COVID-19. So we'll have to make means to make sure we deal with those issues if it means improving communication, because it is sitting at the door of opening up economic activities in the country. So if we are sitting at that level, we will take whatever it means, and the minister championing us to really make sure we up our communication strategies in that regard.
I wonder if government is speaking the message of the language of the people here, especially when you look at today. There's a webinar that government is scheduled to have to address concerns around vaccine hesitancy, but the people who really need this message may not necessarily be watching at the time, and government may need to urgently go to the grassroots levels and speak to the people and address some concerns, which some experts are saying are as simple as people asking, why should I get vaccinated and wear a mask? So if people are not able to watch these webinars, is government really speaking the language of the people here?
Yeah, those webinars are still important because then we get some of the leaders who are able to log in to take the message. But we do have a whole host of provincial leadership, MECs, HODs, like we are talking about the success of just one province, and many others are coming in. Getting into those webinars is for us to consolidate and agree on many voices, but with one message. And therefore, we are not leaving that to that level only. Road shows, TV shows, including radio messages. And they're talking, I mean, traditional leadership is all over the country. So getting, and faith-based organizations is all over the country. Getting the messages to that level of influential leadership will also then cascade the message that we are talking about. So we're not only relying on just one of the methods to communicate, but many more, but to consolidate that one voice of many messages. I mean, one message of many voices is what we are really planning in some of these webinars.
And the age de-escalation has been another area where government has been criticized. When can we see everyone who's 18 and above being allowed to do so? Because the minister said that it's only a matter of time. As soon as the go-ahead is received, then we can be able to see those 18 and above taking the vaccine, which opens it up to everyone.
Initially, the 18-year-olds and above were to be vaccinated as of the 1st of September. There's a consultation that is going on this week, which looks into that, whether maybe we can bring that either then within these 12 days remaining in August. So the minister will be able to guide us on that if the consultations are actually saying go ahead end of this week, or we will have to wait for the 1st of September. But even with that, we will still need those who are now eligible to come in, to be coming in to vaccinate, because we have vaccines adequate enough to really push us fast enough so that by end of this year, we should really be far and be able to say, can we have a reasonably safe Christmas? Can we really have a reasonably safe Easter? Because if we are vaccinated, yes, still adhering to the non-protocol, to non-pharmaceutical protocols, we will still be then ready to then meet and actually greet in a bigger way. But we all depend on South Africans. So I'm not saying the 18-year-olds will leave behind, but I'm saying even those that are now eligible to be vaccinated, please come forward. The decision about the 18-year-olds and above will be made by the minister within the week.
And Deputy Minister, we saw yesterday reports saying that some 32 million J&J doses that were bottled and packaged in Gqeberha were finding their way to Europe, were being shipped to Europe, according to these reports, despite South Africa waiting, for these vaccines. What was your reaction when you saw the story?
No. Ma'am, the vaccines have been bought by Europe. There are vaccines destined for us and even for Africa. Those are not the vaccines that were meant for Africa and South Africa. It has not put us at a disadvantage. They also were actually to be given to that part of the world. There is a proportion of vaccines that are for South Africa. All I'm saying now that we are not running short of vaccines, not at all. But the manufacturing of vaccines in Gqeberha is not necessarily targeting South Africa or Africa alone. It is manufacturing for the world. That is their business in that area.
All right. And if I can just, I know I'm going to be in trouble, but can I sneak this one in here? There was also a concerning part of that report that was looking at the difficult position that the negotiations were in, and the Health Department spokesperson was quoted here saying that government is not happy with the requirements, that we needed to waive the rights to impose export restriction on vaccine doses. When we negotiated here, if this report is anything to go by, we were on the back foot.
Yeah, no, let's hold on to that and actually allow the minister to actually lead that process. I was just mainly expanding on the report that I tabled yesterday. So if you are interested in these other processes that we are still considering and negotiating on, I would rather say let's get the principal to really get us the matching line on those ones. Thanks.
All right. I certainly am interested, and I will be waiting to see if the principal does give us those matching orders and answers that we are waiting for, to see here if we negotiated on the back foot and this leverage that seems to have been, used against us here, if this report is anything to go by as we await the details of that contract. Then let me thank you, Dr. Sibongiseni Dhlomo, who's the Deputy Health Minister, who was in conversation with us. Really, government trying to make sure that a lot more people go out there to get vaccinated and to be able to also take part in that program, and government saying that they are now going to be ramping this up to make sure that a lot more people are indeed going to queue for their vaccination, as the numbers, as you would have seen, even the Premier in the province saying the uptake is low.